from the American Academy of Pediatrics.
Kids around the country are heading back or have mostly gone back to school. Honestly, it's an exciting season. It's supposed to be fun and exciting. This year, though, I do have to say that pediatricians are following the measles outbreak, the falling rates in vaccinations, and a lot of us are a bit worried. Today, we talk about what's happening, what it means, and what you can do to help kids stay healthy and stay in school.
There's a lot of information out there. And when I first had my daughter, it seems to somehow amplify more because the algorithm or what have you, not my area, but certainly you see more and more and more information. And it can be really tricky to determine what is true. And sometimes there's a sliver of information that seems true and then a lot of untruth. And that's really confusing for a parent or caregiver.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I'm a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions and the answers will hopefully be even better. Let's get started. We have so much to talk about today, and to do so, I have with me Dr. Lisa Costello, who is a pediatric hospitalist and chair of the AAP Committee on State Government Affairs. Lisa, welcome.
Thank you so much for having me. Fan of the podcast, learn a lot of parenting tips myself as I have a girl heading into pre-K and back to school here shortly. So thanks for having me.
Oh my gosh, we're so excited to have you. And we're in the same boat. Boy, heading into pre-K in my case. So very exciting time in life, right, Lisa?
Absolutely. A lot of checklists trying to make sure we hit off everything. And certainly immunizations were also on my checklist, as hopefully for many parents they were as well. And other items to make sure I'm doing what I can to help my daughter be as healthy as she can be, to stay in school, to be able to live, learn, thrive with her friends.
Absolutely. So let's get right to it because as I mentioned, we're excited, right? Both of us are excited moms about this. And we're also a bit wary because we know that back to school is back to learning, but it also means back to germs. We know, Lisa, of course, that the vast majority, roughly 92% of kindergartners, are fully vaccinated against childhood diseases. But tell us briefly, why do we care about the numbers?
This is a really important conversation to have, and a question that I get from patients and also from other parent friend groups in regards to why do we need to have immunization rates be so high? And as a fan of the podcast, I listened to Dr. Brown and Dr. Boom a couple episodes ago where they were talking about this concept of community immunity, whereas immunizations work by providing protection to that individual child. And then when we have high immunization rates, we also protect those around us. There are people who are not able to get immunizations for medical reasons. Maybe they're getting treated for cancer and their immune system is weakened, and so they're not able to be immunized. By having high rates of immunizations, that helps provide protection for that individual child as well as the community. And when we're talking about schools and childcare centers, you just laid it out so beautifully that this is a place that germs really like. Kids spend a great deal of time together. They're playing together. They're eating together. They're sharing crayons. They're sharing music equipment sometimes. And that is a condition that germs really like to be able to spread. Therefore, protecting children through immunizations and having those high rates of immunizations really are what help keep children healthy and in school.
Yeah, Lisa, I can't tell you the number of times, especially in the first year of my child being in daycare, that maybe the first 2 years, I should say, I would show up at pickup time and he literally would be holding the water bottle of another child. Lisa, I'm like, not only have you all been sharing toys all day, you're drinking from each other's water, sharing food. I mean, it's just, they share everything. It's what they're supposed to do. And of course, they're going to get some colds and some other things here and there. But what we care about most is, of course, the serious illnesses that can get them into very, very serious trouble and that can be fatal potentially in some cases. So Lisa, let's talk about a concrete example, right? Because we're talking about some of these illnesses. We're talking about how easily germs can spread in schools and in daycares. But let's talk about a concrete example. So if measles comes into a community and 95% or more of the children in that community, of the people in that community are vaccinated, what happens?
When we talk about this concept of community immunity, or what you're asking specifically about in the case of measles, which we've been hearing a lot about, we know that we have more measles cases this year than we've had since the early 1990s when I was in school. And so that's very concerning for me as a pediatrician, and more so, frankly, as a mom, because my daughter has received her first dose of the MMR vaccine. However, she's still younger than what's recommended to get the second dose. And we have been fortunate in the state where I live, West Virginia. We have very high immunization rates because we've had strong school and childcare policies that allow medical exemptions only as a condition for school entry. So in your specific example, if we have immunization rates that are high, above 95%, if that disease enters back into our community, then people are protected. And so we don't see as many cases. And this actually happened in my state. We had a case of measles of an adult individual who had traveled internationally. They were under vaccinated. And in our state, we were able to keep that outbreak to only that one case. And because of those high immunization rates, that's really what helps keep those diseases out of our communities. Unfortunately, when we see rates of immunization fall for any reason, for reasons of perhaps non-medical exemptions as a policy in school entry, or other reasons, we saw dips in immunization rates during the pandemic, for instance, because practices were closed. It was hard for individuals to get to different locations. When we see immunization rates dip for any reason, that is really what increases our risk of these preventable diseases such as measles. And unfortunately, we've seen that in West Texas, where there's been pockets of lower immunization rates and there's been more and more cases. So even within states that a state itself could have higher immunization rates, it's really important to know down to that community level what the immunization rates are in that community, because if they're lower, that's going to increase the risk of these diseases like measles spreading.
Yeah, such a good point that you bring up, Lisa, because we can, read potentially somewhere that a state has an immunization rate above 95%. But if there's pockets of communities where that is lower, and actually like much lower, as it happened in Texas, those diseases are going to spread because they are extremely contagious. And while we're talking of contagious, remind us for a second, Lisa, how contagious is measles?
Measles is very contagious. It's one of the most contagious viruses that we know about. It's spread through the air, can actually stay in the air for 2 hours. So someone who has measles could come into a room and then you later go into that room. And if you don't have immunity to measles, you could contract that disease. And so when we're talking about school or talking about close settings, we really need to consider how contagious different viruses are. And measles is the example that really we use first, because we need to have high rates of immunity in a community, over 95%, to be able to prevent the spread of that disease, because measles is incredibly contagious and can cause really serious complications. Some people might get a fever and a cough, symptoms that we see in a lot of different viral illnesses. As a mom and a pediatrician, I see a lot of. However, they can then also get really, really sick, end up in the hospital, have a lung infection, could have seizures, and unfortunately, as we've seen in Texas, even die. So I think it's important that we remember that these diseases are really contagious, and our best tool we have in our toolbox is to prevent them from getting the infection to begin with. And the safest way to do that is through immunization.
Absolutely, no doubt about it. And I mean, truly, every child that dies in general, but even more so from a preventable illness, is one child too many. Now, Lisa, there's a piece of context that we haven't discussed yet. You kind of started to mention it, and that is the vaccination rates are falling at the same time that vaccine exemptions are growing. In other words, some parents are opting out of participating in the community protection bank, to call it that way. What are exemptions, Lisa, and how are they determined for individual communities?
This is an issue that's getting a lot of discussion, whether it's in the media or certainly in my social media circles, exemptions to immunization policy. So all states, including DC and Puerto Rico, have immunization requirements as a condition for childcare and school entry. What is different across those states is what type of exemptions are permitted for those requirements. As we've kind of already talked about, school settings and childcare settings are somewhat unique. Kids are spending a lot of time together in very close contacts, eating together, sharing different items, and that is one in which germs really like. And so we really want to try to keep schools and childcare settings safe for children. And so when we talk about having immunization policies, part of that is to help keep children and those around them safe and in school. And when we talk about exemptions, I think of it as medical exemptions and non-medical exemptions. So I already briefly mentioned that there are certain individuals who medically are not recommended to get immunizations. I mentioned an individual who's getting care for cancer and their immune system may be weakened. There are some rare instances as well to certain vaccines that people may have an allergic reaction, and then it's recommended that they no longer receive that particular immunization. Those are medical exemptions. Those are important when we're talking about these school exemption policies because we want those who are medically able to get immunized. However, as we've been talking about community immunity, we need to keep immunization rates high to keep the community protected. When we talk about non-medical exemptions, and different states vary in what that means. Some people refer to them as philosophical, personal belief exemptions, religious exemptions. So there's a wide variety. I think of it more as medical and non-medical. And when we see non-medical exemptions in states, there's lower immunization rates. And that's why the American Academy of Pediatrics and groups look at this and talk about from a policy standpoint, why only having medical exemptions as a condition for childcare and school entry is really the best policy to help keep children safe and healthy in schools and keep that healthy environment in schools where kids can stay to live, learn, and grow. And so every state is different. So depending upon where you live, it will be different. So in my home state of West Virginia, we've had really strong immunization policy, nation leading actually, where we've only allow medical exemptions as a condition for school entry. And just to show how this policy works, in school age children, we're one of the lowest immunization states. However, because of our strong policy, we then become one of the best immunization rate state. We've been consistently above that 95% threshold that we've been talking about for measles that then affords us to have protection within our community. So unfortunately, when we see non-medical exemptions for a variety of reasons, and it varies across states, we do then see immunization rates decline, and that really puts the community and the schools at risk.
Lisa, I didn't know that about West Virginia. And what a fascinating example of these policies working, right? Like these policies at play. Really fascinating example. Now, to stay on the same topic for a second, I want to ask you, so say for example, you have a child who has a medical exemption, right? A child who is undergoing chemotherapy and their immune system's compromised. They cannot receive a specific vaccine or vaccines in general. And now you have a child in the same school or several children in the same school who are receiving non-medical exemptions, right? So personal reasons, religious reasons, et cetera, that they're not being vaccinated. How do those kids who don't have a medical exemption impact the kid who does?
It's a really good example to bring up, and why the AAP and pediatricians have looked at this issue and really have made that recommendation for only medical exemptions, because we'll just use 10 because that's an easier number. If there's 10 kids in the classroom and one of them medically can't be immunized, that's already like down to 90%. If you then add in 2 or 3 individuals who could medically be immunized, however, they have a non-medical exemption, that would then decrease the immunization rate to 60 to 70 within that classroom. And therefore, if somebody would enter the classroom that has one of these preventable diseases, we'll stay with the measles because it's certainly been seen, unfortunately, a lot more, then we're going to see more cases. And so really, it's important when we're looking at that community immunity piece that we've been talking about. That's really important in the school setting, particularly because of those close contacts that kids and others share in the school setting. And like, I get it. I mean, you get this too. Like, parents are some of the busiest people around. Like, we're rushing around, trying to make magic happen for our families, trying to get everything off of our checklist. And in some places, it's so easy to get a non-medical exemption that when you go to enroll your child in school, if you can just sign a form, even the most well-meaning parents will sign that form. We overwhelmingly know that the majority of people choose immunizations for themselves and their children. The majority do. However, in some places, such as my own, that policy is what gets parents or caregivers to kind of act on that intention. And it's a safeguard that really then helps protect kids in the school. So I get it. Parents are incredibly busy. Caregivers are busy. And these policies are put in place to provide that protection. Unfortunately, in some places where it's really easy to get that non-medical exemptions, people will choose that option solely because it's the easier option to choose, even if they would act on getting their children immunized.
Yeah, and not always realizing that long term, right? This is definitely the more risky choice to make, even if it is the more convenient choice to make in the moment. Now, speaking of parents being super busy and having 10 million things on our plate, talk to us about some of the barriers the parents face when they try to access vaccines, because time is definitely one of them, but it's not the only one.
Hailing from a rural state, I completely get that access to care is nowhere near where any of us would really want it to be, particularly for pediatric care. There are some counties in my state that do not have a pediatrician. And so I completely can relate to the challenging access that exists in many places, including where I live and work. And so that's another reason why pediatricians do advocate for better access to care, whether that's working with a local health department and the county health department to offer immunizations. In many places, there are school-based health centers. I certainly, as a pediatrician, really strongly believe that people should have a medical home and they should make that relationship with a pediatrician or a group of pediatricians. I certainly appreciate that with my own child, having a pediatrician that we see each time that we have that relationship with that also then knows my child. However, when it comes to immunizations, having access in other ways, such as through a county health department, through a school-based health center, are other ways that we can hopefully improve access to immunizations. And I've even seen in some places where they'll have immunization clinics while they're doing that enrollment for school, so that you could bring your child with you while you're doing that enrollment process, and then also make sure that they're up to date on their immunization. So we certainly have to continue to work to expand access to immunizations. And as pediatricians, we continue to speak up at the community level, at the state level, and even federally to have policies that can ensure children have access to these life-saving immunizations.
Yeah. And hopefully parents who are listening know this, but cost should never be a barrier to receiving a vaccine. I mean, thanks to the Vaccines for Children program around the country, really cost has not been a barrier when this program is appropriately implemented, right? But worth saying, because I think sometimes, when you're a new parent, what do you know? Like, you don't know if they're going to charge you for a vaccine. So just to say that cost should never be a barrier. Lisa, the other thing, of course, and I don't need to tell you this, is that we're living in a time when misinformation about vaccines spreads very quickly. How do you approach correcting myths when parents bring them up? Lisa, I'm curious.
I'm so glad we're talking about this, and thank you, Edith, and your whole team for this Healthy Children podcast to bring information from individuals' trusted sources of information. There's a lot of information out there. And when I first had my daughter, it seems to somehow like amplify more because the algorithm or what have you, not my area, but certainly you see more and more and more information. And it can be really tricky to determine like what is true. And sometimes there's like a sliver of information that seems true and then a lot of untruth. And that's really confusing for a parent or caregiver. I always try to listen and to listen with empathy. As I shared before, I get that people love their children fiercely and they're really trying to do what they think is best for their child in any situation. And so we should welcome questions and be able to provide information. I also think it's important for any pediatricians also listening and also parents is that it may take more than one conversation.
Yes.
There might not be that one conversation where you have that and then somebody's mind is changed. It's really like a spectrum of confidence in immunizations. I'm far on the one side, like I would walk miles to get my child and myself immunized because I've done my research. I've seen, cases that I can't help with. So I want to take the opportunity to have my child and myself and my family as protected as possible, particularly to many of these devastating diseases. I completely appreciate that there are other people on different spectrums. And so I think it's important as a pediatrician to approach that with sitting down, listening, providing information, opening a space to say, what information could I provide that might help you in making a decision? This is not my kind of metaphor, if you will, but I think of it as like planting a seed. You might have that first conversation that you plant the seed and then somebody comes and waters it. You see something, you've done your own kind of information, and then eventually it grows. You may never see the end product. However, if we don't start having these conversations, then we never really kind of plant that seed that this is something that's really important. And so there's a great deal of information out there. I always recommend people going to places that I go for information. And the top of that list is the American Academy of Pediatrics, including healthychildren.org, because the resources there, I myself have contributed to healthychildren.org. I myself as a parent have found helpful information there, especially when I'm trying to talk or send other family members to get information. And so I think it's really important to get information from trusted sources, talk with your child's pediatrician, and ask questions that you have and get the answers that are based upon the science and the evidence of how we know immunizations are so important and how they work.
Yeah, no, absolutely. And, I think knowing who's writing the content on healthychildren.org for me is huge, right? I know it's people like you, practicing pediatricians who are also parents, who have different areas of expertise that are writing that content. And I think to me, that goes a long way. Lisa, as we come to the end of our show, we like to end every episode with what we call a parenting prescription. So when it comes to keeping children safe and in school, learning, what is one thing you want all parents to remember?
My parenting prescription would be when we're talking about schools and keeping kids healthy, immunizations are the best way to help your children live, grow, and thrive. Talk with your pediatrician, get information from trusted sources, and in the end, hopefully you'll be able to learn and see in choosing immunization as the way that you can help your child stay in school to help them live, grow, and thrive.
Love that. Thank you so much, Dr. Lisa Costello, for joining us today.
Thanks so much for having me.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP. And be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos,
Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega, Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.